your husband moved. Yeah. Think we'll have Yeah. Yeah. Are you going to the conference? There you go. we want? Healthcare! When do we want it? Now! What do we want? Healthcare! When do we want it? Now! What do we want? Healthcare! When do we want it? Now! What do we want? Healthcare! When do we want it? Now! What do we want? Healthcare! Now! What do we want? Healthcare! Now! What do we want? Healthcare! Now!
This is a first.
What are you going to do there? What state is it? Is that in Colorado? Patience over profit! 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 Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho! Health insurance has got to go! Hey, hey! Ho, ho!
Mind if I ask you a question on the live stream? It's okay.
Not be on the live stream.
That's fine.
Everybody
Healthcare, yes! Denials, no! Profiteers have got to go! Healthcare, yes! Denials, no! Profiteers have got to go!
Nobody in, nobody out. Everybody 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 in, nobody out. Nobody out. Nobody out. Everybody in. Nobody out. Everybody in. Nobody out. Everybody in. Nobody out. Everybody in.
is a right. Fight, fight, fight. Healthcare 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 is a right. Fight, fight, fight. It's a right. Healthcare is a right. Stay tuned. Fight, fight, fight. Healthcare is a right. 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 Fight, fight, fight. Healthcare is a right.
Good afternoon, friends. Welcome to Minneapolis, Minnesota. I'm Rose Roach, the Executive Director of the Minnesota Nurses Association, and I'm happy to be with you here today. Seeing all of you here ready to organize and fight for health justice makes me think, you know what? We can win this. Think we can do this? Can we win Medicare for all? I say in Minnesota, yeah, you betcha. I'm excited to see so many people from all over the country. I see some longtime friends and a lot of new faces, proving that healthcare really is the issue of intersectionality for the broader social, racial, and economic justice movement. The surge in activism around single-payer Medicare for all is like nothing I've seen in all my years working on healthcare reform. The momentum is on our side. We have reached a tipping point where the majority of Americans believe the federal government should provide and make sure that all Americans have health care, favoring a Medicare for all type system. People aren't excited about more incremental changes. We don't fix broken bones incrementally, and we don't fix the healthcare system incrementally. Incremental tinkering has become the weight of our time. Dr. King once proclaimed, justice delayed is justice denied. So it is with healthcare. Healthcare delayed is healthcare denied. Yes, the momentum is on our side, but does that mean that we can just sit down? No. Can we take it easy and assume everything is going to be okay? No. Friends, I don't know if you've heard, but the medical industrial complex has deep pockets. The insurance companies, big pharma, hospital chains, and all those financial middlemen like the system just the way it is. Why is that? For them, corporate greed supersedes patient need, and nurses say, oh no, it doesn't. The only competition in our healthcare market today drives prices up, not down. And that's because too many Americans treatable diseases every day in the wealthiest country in the world. Shame on them. It's because a handful of executives and shareholders reap huge profits from denying care. Shame on them. And it's even because right now our federal government keeps trying to make the system even worse by cutting Medicare and Medicaid, the only safety nets we have for the poor, the disabled, and the elderly. Shame on them. Is this the America that we want to live in? No. Where our human lives are worth less than United Health Group's profits? No. Where families choose which child to take to the doctor and which has to stay home? Also, healthcare stocks can pay big dividends? No. Here's the America that nurses want. An America where every person has inherent worth and dignity, rich or poor, young or old, black, white or brown, healthy or sick, citizen or immigrant. Nurses don't care. Nurses don't care about your insurance card, your credit card, your green card. They only care about your get well card. An America where every person can get the health care they need when they need it, no exceptions. An America where our government reflects our values of community care and compassion, and an America where public officials are responsible for checking the corporate greed that hurts us all. Are you with the nurses on this? Isn't that the America that we want? Guaranteed health care is going to make it better for all of us. We can't and won't stop until we get Medicare for all. We are unstoppable. Care for all is possible. We are unstoppable. Care for all is possible. We are unstoppable. Care for all is possible. Yeah, all right. Now I want to introduce to you the president of the Minnesota Nurses Association and one of the fiercest advocates for patients and health care for all, who I have the pleasure of working with, Mary Turner.
Truck. Too old for that. All right. Like I said, my name is Mary Turner. I'm the president of the Minnesota Nurses Association. But I'm also a practicing intensive care nurse at North Memorial Medical Center in Robbinsdale. And I'm telling you what, people, I see every night the effects of a broken healthcare system. And we got one little story that we've all seen in the paper not too long ago. A young man, 26 years old, named Alex Smith, was unfortunate enough to have type 1 diabetes. And when he turned 26, he ran out of health insurance. He had to get off of his parents' plan. How many of us out there are parents that worry about our children approaching the devastating age of 26? When we worry at night whether they're going to even get a job, that the employer will be kind enough to give them enough hours to have health insurance. How many of us have that worry? Well, Alex, yeah, raise your hands, ladies and gentlemen, raise your hands. So Alex, he turned 26. He was not poor enough to get on a public plan, and his job didn't provide insurance. So he couldn't afford a plan. And so what he started to do was to cut back on his insulin. Started to ration it. And what ended up happening is that he eventually went into diabetic ketoacidosis, which is when your blood sugar gets so high. And this young man, 27 days after he ran out of insurance, died alone in his apartment. And I know what he was thinking. I know what he was thinking. He was thinking, I don't have health insurance, so I can't go to the hospital. I can't go to HCMC. I can't go to North Memorial in Robbinsdale, or any other hospital. But I'll tell you what, the nurses and the doctors, we would have taken care of him. We would have brought him in, and we would have put him on an insulin drip. And this happens, I'll tell you what, and we would have saved his life. But I know that young man sat alone in his apartment and thought, I don't have health insurance, so I can't go in. I just know it. And so he died alone, and he died unnecessarily. Every night, we had one night in my intensive care, we're a 13-bed unit. 5 patients in 5 hours came to our ICU floor in the same condition that Alex Smith was in. The average cost of a hospital bed in the intensive care now is $18,000 a day. The average cost of insulin for a month is $700 to $800. That's great if you have insurance, but if you don't, you end up like Alex Smith. I'll tell you what though, wouldn't it be better to give everyone their insulin who needs it at $700 to $800 a day versus $18,000 a day, $700 to $800 a month versus $18,000 a day? This doesn't have to happen, people. We've got an answer for this, and it's called Medicare for All. I know as a mother, I'm crying for Medicare for All, so I don't ever have to worry about the people I love dying alone without health insurance. And I care as a nurse because the tragedy that I see night after night, that all of the nurses here see day after day and night over night, will end, and everyone will have the right to have health care, and everyone will receive health care so that we can become a better, healthier America. Thank you. All right, Mary Turner. Yeah. Next, I want to introduce you to my good friend Paul Sobozinski. Paul is a hog farmer from Wabasca, Minnesota, and he is a tireless advocate for health care for all. The nurses work with the farmers to move into rural Minnesota and make this happen. Paul.
Thank you, Rose. Well, I am a livestock farmer, and yes, I do farm out in Wabasca, Minnesota. This morning, I was working in a hog feeder cleaning up for my pigs after having 3 inches of rain. So I know what it means to be actively engaged. So I'm a real farmer. I also know our organization, Land Stewardship Project, is part of an effort called Our Minnesota Future. 22 organizations united together across this state, saying that we have to change the system where people count first. And that's a very important part, a very important step for us to take. You know, so often, elected officials, especially too often from rural Minnesota, trying to play the game of dividing urban and rural. But in order to get done what needs to be done in the state for everyone, we must be all together. This year, as a legislature, we saw the game of divide. Nothing done for health care except try to attack people on Medicaid, the very poor. The one thing they can count on health care to take that stability away from them. An absolute crime. Well, we stopped them this year at the legislature, but they also stopped us from moving forward. So we have to change that. We have to get elected officials who are going to stand with the people, not with the corporations, not with the insurance companies. At Land Stewardship Project, we believe having the security of knowing we can receive medical care when we are sick or hurt and that we can afford it financially would create a new health care system for all of us, both rural and urban. So that's how we have to come together, united. Thank you very, very much. Again, let's all stand together united to change this health care system where people count first.
Thank you, Paul. And for our final speaker, I want to introduce you to Rebecca Wood. Rebecca was thrust into the life of a healthcare activist by a healthcare crisis that turned into a financial crisis for her family.
How's everyone doing? Wow, normally I have to tell people to do it again, but you guys are great. I'm Rebecca Wood. I'm from Charlottesville, Virginia. And before last year, I was just the basic soccer mom. But I was brought to Capitol Hill because I had to fight for my daughter's health care. She was born at 26 weeks gestation and weighed 1 pound 11 ounces. For the 3 months she was in the NICU, I wondered if we were doing the right thing by keeping her alive. Yet she fought, and she fought hard. And last month we celebrated her 6th birthday. However, it wasn't as easy as it sounds. I had to fight insurance every step of the way for services like OT, PT, speech, and feeding therapy. I had to drive across the state to find services that were affordable. And I had to make impossible choices. My daughter was 3 when she was in speech therapy and started to speak. At the same time, I broke a tooth in the front of my mouth, which came infected. I needed a root canal and a crown. I decided to pay for her speech therapy and put off my root canal and crown to the next pay period. Unfortunately, during those 2 weeks, the infection spread throughout my mouth and jaw. I had to go to the emergency room because my airway was cut off. After I was given IV antibiotics and discharged, I went to the dentist the next day and all of my teeth were removed, parts of my jaw were scraped away, and parts of my jaw were cut out under a 6-hour procedure in local anesthesia. It should never have happened. My daughter turned 6 last month. We weren't supposed to win the ACA fight last summer. And you know what? We're going to win Medicare for all! That brought me to the fight, and I'm not stopping until we win. All right, guys, this is where I'm going to hear you. Fight, fight, fight! Healthcare is a human right!
Fight, fight, fight! Healthcare is a human right! Fight, fight, fight! Healthcare is a human right! Fight, fight, fight!
We will do this, and we will win! Thank you, Rebecca. When did it become okay to parent by Sophie's choice in this nation? Unacceptable. Now we're going to continue our march. Let's make sure everybody here in Minneapolis, now even in St. Paul, hear us. Let's get moving. Everybody in.
Nobody out!
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 Hey, hey, ho, ho. Insurance companies have got to go.
Hey, hey, ho, ho!
Insurance companies have got to go.
Hey, hey, ho, ho! Insurance companies have got to go! Hey, hey, ho, ho! Insurance companies have got to go! Hey, hey, ho, ho!
Insurance companies have got to go. Hey,
hey, ho, ho!
what did you?